Good morning, everybody. Thank you for waking up so early. After yesterday, it wasn't easy, right? Most of us were friends already, but just to emphasize what I was telling you yesterday, that the good thing about Sunekos, beyond science, is that we are friends. And seeing how you come from all over the world and how you really put Sunekos on as your big priority and take the time to share this with us makes us very happy, because there's a lot of science behind Sunekos, and you heard it already yesterday from Tiziano, from Ebs, from Marko, and we're very happy to share it with you, because many times when you talk about
Divided like between.
no, that's fine. Does it look familiar to you?
Yes.
No, you're done with the AJ, but it's fine. You see how well organized we are? I'm like, no, Ashras, no, then you go first. It doesn't matter. You put some slides and it's just easy to talk about it. Because with Sunekos, whenever we get to talk about it, we're happy because we have the support and the scientific background. Because it's a different story. Because whenever you get on the stage, they tell you, now you must start with the storytelling, right? All of you who speak out there, you know that it has to be a storytelling. So you have to be like, oh, and I remember when something happened. Well, me, I remember when it started. I still remember the day when I sat down with Tiziano and he totally convinced me. Because how he convinced me, just like he convinced each one of you, by science. And I wouldn't like to spend too much time, because you heard a lot about it, just digging into some key points. Because indeed, Sunekos is coming from professional dietetics, but professional dietetics is not coming from aesthetics. Professional dietetics is coming from the pharma world, from deep scientific know-how, from being for almost 30 years global leaders, one of the big global players on amino acids. And they have implemented this in a different direction, in wound healing, in tissue regeneration, in clinical nutrition, in ICU units, in neonatology, in very deep, very important medical points. And with the exact same methodology that they were using, for example, to decode which is the best sequence for patients with sarcopenia undergoing clinical nutrition, the same one called Platform, which is their proprietary methodology, they use it to decode what is the best sequence of amino acids to use for giving the best to your skin, not for just improving it aesthetically, but for genuinely regenerating the skin, something that would merge in, something that would be synergical, something that you could use every single time for every single patient and to be sustainable on the long run. Because just to see immediate before and after pictures, we have a lot of options out there. But it is about how they will age under the treatments we're doing to them. And this is how they got an international patent of formula, beyond the patents of use, formula, proving that it's a formula that does something so different. And Tiziano already shared with you some of the awards, and there's more, I'm showing you some more, and there's non-stop validation coming from the science, from all directions, because this is really something different. And I'm sure that you are here with us today because you know already that Sunekos stands out. It stands out from the noise, from the crowd of many, many products that you have out there. And I'm not saying they're bad, because I really believe that for everything that we have, there is a small part that we can integrate it somehow. But what we deserve is the best for our patients. And I mean, sometimes they tell me, oh, and I'm using, I don't know, pick whatever, polynucleotides because they create hydration. Well, guess what? Saline solution also creates hydration for the skin. So I think that our patients deserve way more than putting some liquid inside to hydrate the skin. Because as we get old, hydration is not the main issue. We can put serums for that. We really need a big build of sustainable protein synthesis. And this is what this patented formula is giving you. And there are unique ingredients inside that look so simple, so easy, and so easy to find in any congress with so many brands, and yet they're so different because their mechanism of action is totally different from what we were using, which was that constant inflammation that, let's face it, it was good for us for many years. We were getting results with it, right? I mean, it was on the market since 1999 as a polymizer, then it's collagen inducer or whatever. So we've been using these things, and now everybody's playing with them. But let's think about what's the correct integrative point of view. Because now you have in your hands something that can not only do the trick for you, but can also prepare your skin for everything else. So Sunekos is a driver of clinical practice. It is a driver of shifting the paradigm from I want a clinical result right now, right away, a bigger chin, to I want a healthy looking skin for my patient who now chose me as a physician so that he will still or she will still choose me in 10 years from now. And this is a synergy between efficacy and safety. Because everything that you do for skin quality, you have to repeat. And the moment we're talking about repeated procedures, we need to talk about safety. It's true generally in medicine, we assess safety first, and in aesthetics or even regulatory, you must prove efficacy for injectable devices. Well, Sunekos brings you both ends, but it will always add and top you up with that safety and peace of mind, because you will have sustainable results, something that you can keep doing, and you know that if I start today, it will never be too early, and if I start tomorrow, it will never be too late for the patients, because it overcomes what we are dealing with for such a long time, which is the inflammation, which has some good points. I mean, if I cut my finger today, I'm happy I'm getting an inflammation because it's part of the healing process. But chronic repeated inflammation that we're doing by placing many times foreign body materials in our skin, that leads to the inflammation that we were talking about yesterday. And that leads to issues like fake loops, fibrosis. Everybody was blaming only hyaluronic acid for the fake loops. But fibrosis is part of the fake loops. When you smile like this because your face is really fibrotic, yeah, that's part of the fake loops. And repeating procedures where after the third procedure I can barely push my cannula, I need to go to the gym to be able to advance because I started polylactic acid or whatever, whichever one you think about, too early. This is a real challenge because I started today to my patient and the same patient will come 10 years later to me, but guess what, next year I already can't repeat the procedure anymore because the cannula is just not advancing. And then we're talking about how we'll take saline solution to hydrodissect to create space, to create some more fibrosis. Is this the best option we have in 2025? No, come on, we can do much more than that. And it is this magic receptor that we've been talking about so much yesterday, which is the CD44. Because there's a bunch of receptors sitting out there, including 2-like-2 and 2-like-4, that are mostly responsible for inflammation. But the CD44 is not. Its magic is the ability to modulate the activity of the fibroblasts, to give you something that is a biomimetic bandwidth. This is the way our body works. And this is how we manage to modulate the activity of the fibroblasts to regain homeostasis. Because if you think about it, homeostasis is responsible for the general health of the body. Whichever tissue loses homeostasis, a disease is arising from there. And in our skin, the disease is called itching. So this is the key of success. This is why if we look at a baby's skin, it's so elastic, so nice, and yet no fibrosis inside. Because collagen type 1 that we were speaking about yesterday, it is very nice, but it has to be balanced by the other proteins, because if not, it just becomes profibrotic, of course. So equilibrium, just like in life, even if you love too much, even love too much is not good. So everything that's too much is not good. We need supportable results by having the balance between all these proteins. And we wonder, well, if this is so important, why the industry doesn't talk about collagen type 4 and type 7? Why is everybody only mentioning type 1 and sometimes type 3? Because those are the typical ones that you generate by inflammation. Type 4, type 7, which are essential because type 4 is the one forming the anchoring plaques and type 7 anchoring your fibrils. They are not produced by merely inflammation. You need time and activity that's normalized for the fibroblasts to be able to go into those productions. And then those are the ones that are creating anchorage for your fibers. And it's not even only collagen. It's fibronectin who's anchoring your collagen fibers to the surrounding cells. And elastin, which is so little, only 2%, and yet you saw it yesterday with Marko, how important elastin is. And by the way, Marko, I loved your explanation from this yesterday. That was very visual and easy to remember how important elastin is. And it is very little, but it is crucial. And you saw how hard it is to obtain it. As many companies will show you, we increase the gene, okay, and then all goodbye because it was just by merely inflammation. It will not settle within the extracellular matrix. So it's not just about starting the synthesis of proteins, but making sure those proteins get deposited and integrated within the ECM to be able to build structure. Because our skin is about structure, about the right structure to be able to stand, to get that volume repositioning. Sunekos is not about gaining volumes, it's about repositioning the right place, the volumes that most of the faces already have. Or even if you choose to put a filler over time, it is placed within a tissue that's gliding as time goes by. So I need support for everything that I'm doing volumetrically by skin quality, because definitely we need volumes as well as we age, because it's part of the aging process. And if you look inside, just amino acids and hyaluronic acid, that's very basic. It is very basic and good, well done things. That's how you can be synergic with your body. Because if you invent new mechanisms that are not part of the normal behavior of the body, like inflammation, where they see there's an attack coming, of course that is not sustainable. But amino acids and hyaluronic acid, although they sound pretty plain, they are very different because you find them in tons of products. I mean, now you even have toothpaste with hyaluronic acid. I'm sure toilet paper with hyaluronic acid is coming out soon because it's a trend. But what about this hyaluronic acid? What is it so different about it as a raw material? How can we look into it? Because we're always saying cross-linked and non-cross-linked. Okay, Sunekos is non-cross-linked. And then it is high or low molecular weight. Because as we mentioned yesterday, if it is low molecular weight, that's the one that's strongly able, those small fragments, are strongly able to stimulate the CD44. That's their main paper. And they will cluster receptors, and that will potentiate even more your results. Okay, but what about high molecular weight? Still very important. We have it endogenously as well, and that plays a strong antioxidant role. It's also a strong anti-inflammatory for you. It also plays a role antifibrotic agent, but it is weakly able, compared to the low molecular weight, to stimulate the receptors. So this is why you see that the Sunekos range, with the exception of the 1200, the rest, they're all based on low molecular weight. But low molecular weight is very tricky. Because low molecular weight, our native low molecular weight, comes with open ends. The ends are open, and there is where enzymes like hyaluronidase come to cleave, to cut pieces of it. And those small pieces that are being cut, they're the oligomers, and those are really pro-inflammatory. And this is where also reactive oxygen species attack it. And this is why it is so unstable. Now, in comparison to the native one, there's something wrong with the slide, something jumped there, so you will have to rely on me. This is why I don't like to move things from my laptop. I like to put it from mine because I know where they are. So compared to the native AJ, the one as raw material that Sunekos uses, which comes from France, is a closed telomere hyaluronic acid, very particular. They use a cap-end closing strategy, which is of course proprietary of the brand, to close the ends so that it becomes much more stable and much more reliable and less reactive, less of a site where enzymes, oxidative species like reactive oxygen species, and all of them can cut. So you have a more stable product, you have a more reliable product, and you have a much more pure product. Because many people are asking, okay, but Sunekos is quite expensive. Of course, because the raw material, this high purity, ultra pure AJ as raw material is around 20 folds more expensive than normal AJ that you will find with the other products. But this is why, and Abs will talk to you about it, this is why this AJ is not pro-inflammatory, although it is low molecular weight. And this is very unique and very particular. It's like, no, all diamonds look the same, and yet there's a huge difference between them. And then it's not only the AJ, it's also the amino acids. Because it's only 6 of them, and you find there are brands who have 7, 20, and so on, which compete for the number. But more amino acids doesn't mean better result, and this is very important. Because more amino acids mean more competition for the same soluble carriers, because it's the soluble carriers who have to carry them inside. So they will generate competition, and they will not go in the correct adequate amount and order, so you decrease protein synthesis. So this is why you have a unique patented formula for these amino acids with Sunekos, and this is why you do not have more than 6, you do not have less than 6. And it's not only which 6, but also the equilibrium between them, the proportion between them that is so unique, and this is why it is able to behave so differently within the tissue. Because look at AJ, normally, non-cross-linked AJ lasts very little within the tissue. Because of the open ends, hyaluronidase comes, cuts on it, and this is it. Hydrolyzation, goodbye. But Performa has a much longer behavior and a much longer life within the tissue. Why? Number 1, closed telomeres. Number 2, amino acids. What do? They are positively charged, mostly due to lysine, while hyaluronic acid is negatively charged. So it's like a magnet. They cluster around it, they create a shield, and they are hydrophobic. They push water away, and just with that, they push hyaluronidase away. So you have 40% less degradation by hyaluronidase, much more time for your acid, for your hyaluronic acid to sit within the tissue and to keep stimulating the fibroblasts. This is why with Sunekos you're getting this unique collagen type 4, collagen type 7, fibronectin, high quantities of elastin, sustainable production. This is why it is so different, because it behaves in the normal way. So are all, this is for you Tiziano and for Paolo, so are all hyaluronic acids the same? No. And just like good quality Italian tomato sauce, you cannot compare it to ketchup. Sometimes ketchup has a very heavy branding. So do not trust branding, because branding can be very deceiving. And it can present you the most beautiful photoshopped pictures, and yet look at the raw materials inside, look at the science inside. Because really, what Sunekos gives you is so different, and this is why from younger patients, and this is Vizia, because yesterday a very dear friend of mine told me that one of my pictures was not very perfect, so then don't rely on pictures, fine, but Vizia is as standardized as it gets, so you see improvement in wrinkles, fine wrinkles in a younger patient, significant clear. Okay, but what if we go to older patients who have fewer fibroblasts and more damaged fibroblasts, 70-year-old patient, still significant improvement. And look clinically at the marionette area, because I cannot preach about. Let's look only at the marionette. It looks like it's filled with a filler. And this is 1 month after the complete of the protocol. So it has nothing to do with inflammation or volumization. This is due to the repositioning of the tissue and to the anchorage proteins that you are getting out there. And this is how Sunekos clinically stands out. And this is how Sunekos, well, stands out also from the scientific point of view, because it's biostimulatory, but it does it from a totally different perspective, by anti-inflammatory, anti-fibrotic, sustainable way, giving regeneration and long-lasting results to your tissues. And with this I thank you, and now Abs, this is yours.
Yeah, that was my mistake. Okay, thank you, Andreea. So one of the things that Andreea mentioned was to do with the hyaluronic acid and the way it's potentially inflammatory in some products. So we have some new data, which I think even the people that have used Sunekos, you won't have seen this data, to show you the difference, the really, really important difference between the hyaluronic acid in this product and hyaluronic acid in other products as well. Let's have a little look at this. So, why do we need to understand whether or not the HA is going to be inflammatory? Because that will completely change the pathways that are triggered in the cell, which determine the protein output. So a cell can produce the same protein in different ways. If it's produced in one way, sometimes it will make the protein just on its own, and in another way, it will produce the protein with everything else that's needed for optimum function as well. So for example, if you inject dermal filler into someone's face and there's a bad reaction, the body can create protein to seal that dermal filler to try and protect itself. Now that same sealing activity, those same proteins, can be used in different ways to make the skin better quality skin as well. So if we don't pay attention to the inflammation, we can more likely lead to things like scar tissue, which I'm sure we all know as well. And it also reduces the number of different types of proteins. So if you were here yesterday, you would have seen a long list of proteins, a long list of collagens, which the product produces, which no other product can produce. That's because of some of the data which I'm about to show you as well. And if you increase the amount of time spent in physiology and not in inflammation, that also maximizes the protein you produce. So for example, if you carry out a treatment which creates some inflammation to some extent, even if it's not to a large extent, immediately after the treatment, what is happening is the body is trying to fight that inflammation so that it can then go into building. So for example, if you go to the gym, you break the muscle fiber. This is, in a sense, inflammatory. So there is a time spent, you are trying to fight that before you grow. So people think exercise makes you stronger. Exercise makes you weaker. It's the recovery that makes you stronger. And so if you maximize the time spent in physiology and less in inflammation, then you can produce more protein. And we're going to show you now exactly with in vitro and in vivo slides that this is what's happening with Sunekos as well. And so therefore you reduce the fibrosis risk if you are not spending time in that inflammatory zone. So just a quick recap for those of you that aren't aware. So different molecular weights exist in the body. So roughly speaking, we go up to around 8,000 kilodaltons of molecular weight in the body. And there is no tissue in the body without hyaluronic acid somewhere. It is always present in some capacity. And we have different grades, which Andreea has already talked about, cosmetic and pharmaceutical grade. And we can deliver the HA in different ways. So for example, Tiziana mentioned yesterday that we have other fields the company is in, like wound care, scientists, cancer supporting care. The delivery of HA using all those methods determines whether or not it can be used. So for example, if you're talking about wound care, then you may deliver it in a gel, you may deliver it in a dressing, etc., etc. So we have to dress the HA in different ways to get it into different types of tissues. Then of course we have two products with two different molecular weights in the Sunekos range, the Performa and 1200. But if you have two products on the market, if you take these products with the same molecular weight, product A, product B, whatever you like, even with the same molecular weight, technically they can produce different results in the skin. Sometimes they can produce opposite results in the skin as well. And even though HA will go through the same receptors, there's probably at least 10 to 15 different receptors, Siglex, Cypam1, these things we haven't even talked about. If you trigger the receptors in a different combination, you can get a completely different result. If the HA is even in the wrong shape, you can get a completely different result as well. The HA is even allowing oxygen into the cell. We're going to realize. So if you get the wrong shape, you get the wrong weight, you actually change the respiratory ability of the cell. Which is why it's so important to look at what the HA is, not just what is the molecular weight, but what is the quality of that as well.
Sure.
So here is a slightly odd-looking set of diagrams, but I will explain this for you.
Yeah.
So on the left-hand side of these, you see essentially what is the control. And this is the standard deviation, so a range of error within the measurements. Now, if you have a movement of these markers, so interleukin-6, tumor necrosis factor alpha, interleukin beta, if these markers reach this level, roughly 4 on a standardized scale, at that point the inflammatory markers, someone's away here, at that point the inflammatory markers are high enough to trigger the full inflammatory process. Now this is not because it's Sunekos, it's just the general physiology and the way it's working. So with the control, we know that obviously in natural physiology you're not really going to get that because inflammation is different to physiology, it's the opposite. So when we use the weights that we have in Sunekos, we can show, even including standard deviation, that we are nowhere near that 4 level on the scale to actually go into full inflammation. And we have slides to show you other products which do reach that and what that looks like within the body as well. And we have other ones here in different scales. Again, you can see it's very, very close, including the standard deviation of the control, to natural physiology because of the quality of the hyaluronic acid. Is that okay, Tiziana? Is that okay? Thank you. So, we can say that after 1 day at least, there is absolutely no inflammation. In certain types of HA, there is no point measuring it after more than a day or 2 days or 3 days, because different molecular weights, if they're non-cross-linked, will last a different amount of time in the skin. So this is a slide to show you what the difference is. So skin, fat, and muscle. So we can, there we go. So if you look around the hydrogel here, you can see it's slightly darker pink in this one. This white area is the hydrogel, that's the HA that's indicated. And you can see it here, you can see it here as well. If you look at this slightly dark area, you can see that what's represented by I is the inflammation. They're inflammatory cells on the immune system that are coming to the HA. Whereas here, it's just not present. And so after 1 week, we can see all the HA has basically been removed, and there's no inflammation present. Whereas if you look at the other HAs, it is still present, and the body is still trying to fight. And this is the Sunekos version, where everything is completely back to normal. And that's after 1 week. So even with the same molecular weight, a week later, you have a completely different lifespan, and you have a completely different level of inflammation that's present. So the molecular weight is a way of saying what is the physiological function of the skin. It's a way of saying how much time will it be in the skin for, because we think the lower weight, the quicker it is to remove. But that's not necessarily the case, because if the lower weight leads to inflammation, it will actually stay there for longer because of the lining around with immune cells, which is a big, big difference. So you have to look at more than just the molecular weight nowadays. So we can say that the HA in Sunekos, based on the fact that it's completely removed with no residual inflammation, we can say it's completely biodegradable, just like the natural HA that is produced in the body. And we can say that it's definitely non-inflammatory as well, as compared to other products. Now this is 28 days later, so a month later. And we can see again, skin, fat, muscle, skin, fat, muscle. There is no HA left. There is no residual inflammatory tissue or inflammatory cells of the immune system present. And so we know that even a month later, everything is completely back to normal, which you would expect if it happened after a week later anyway, but there are products where even after 28 days, you will not see this kind of result. So again, it's biodegradable and non-inflammatory. So essentially what we're saying is, if we are using the right type of HA, we can maximize total pulse. We can maximize total protein output with the amino acids, not just because of the specific weights that we've chosen, but because of the quality of the HA itself, meaning that the tissue spends the minimum amount of time in inflammation, mainly due to things like the needle trauma, and the maximum amount of time actually in physiological process building rather than trying to fight inflammation. And that's how we get the biggest range or the biggest number of types of protein. So all the list of molecules and proteins that I gave you yesterday, most amount of time in physiology, and therefore we minimize the amount of time in fibrosis. If you spend longer in the inflammatory time, then what's happening is in that graph where we saw the inflammatory markers, interleukins and TNFs, that will slowly start to build up if you spend longer in inflammation. And if that builds up enough that you reach a threshold, then you do go into inflammation. And so we can say that we definitely do not do that with Sunekos. Thank you very much. I think, Marko, are you next? We'll try that.
I think it's a video.
So it's not.
That's a error.
Hello everybody, my name is Violetta Baranska-Rybak. I'm professor of dermatology, working at dermatology department, University of Gdańsk in Poland for 25 years. I've been teaching students, treating difficult cases of patients and following many clinical trials. I also own private clinic when I do aesthetic procedure and aesthetic-related clinical trials. Today, I have a pleasure to share with you the results of my study performed with sunekosperforma. I treated 3 different areas like forehead, periocular, and neck. We all know that the skin aging starts at the age of 25 and it accelerates after 40. And the speed of the aging depends on many external and internal factors. And we will do our best to slow it down as much as possible. We have a lot of different treatments, different devices we use in our patients, but as a dermatologist, I prefer to act on the skin, to act on fibroblast activity, to enhance extracellular matrix, and to do it, we have quite good solution, not invasive, that help us to restore extracellular matrix and induce collagen and elastin production. We all know that hyaluronic acid is a basic component of majority of stimulators. And when we combine this hyaluronic acid with low molecular weight with amino acids, we can achieve much better results. I think you agree with me that amino acids are a key player in protein synthesis, in collagen creation, and also they are responsible for keeping the collagen in a good shape, but also in elastin production. And when we search through the literature, there are not so many studies proving the efficacy of products containing amino acids and hyaluronic acid published. Actually, I found 3 papers based on quite small group of patients, which I will introduce, and then I switched to my study on quite a big group of 60 patients. So the first study was based on 20 women that have been treated with mesotherapy with product, which is a combination of hyaluronic acid, low molecular weight, and amino acids. The patient underwent 2 weeks, and they had a skin biopsy before treatment and the skin biopsy 3 months after. They also were examined with ultrasound to check if the skin thickness has changed after those 3 treatments. And finally, after 3 treatments, skin density and epidermis density increased. Also, epidermal growth factor increased, but in ultrasound, the researchers didn't see any difference. The biggest published study, based on 40 patients, tried to evaluate the efficacy of hyaluronic acid with amino acids and vitamins on different skin parameters like hydration, density, microcirculation, and also 3 treatments were performed every 2 weeks, and actually hydration, elasticity, and density improved after those 3 treatments, as well as global aesthetic improvement scales were quite well designed. The doctors and patients' impression were more or less the same. Majority of patients and doctors agreed that after those treatments, those parameters and the skin quality improved or much improved. There is also one study focused on neck. It was performed on 15 patients and published this year. And also the skin density and hydration has improved after 3 treatments of hyaluronic acid with amino acids. My study was focused on sunekosperforma, which, as you all know, is an innovative product based on hyaluronic acid and 6 amino acids. And this solution promotes restoration and hydration of the skin, and also it has very good influence on the wrinkles depth. We all know that amino acids are key players in collagen and elastin synthesis. And in this product, we have 6 amino acids with very selected amounts that are good. And to prove the efficacy and safety of this product, I designed 2 groups that has been treated with this product in selected areas like forehead, periocular, and neck. I selected 2 groups, and in each group I had 30 women, and one group was treated with 1 vial of product, and the second group was treated with 2 vials. And I mentioned before, all patients were treated in 3 areas: forehead, periocular, and neck. They all had pre-treatments, 2 weeks being older than 18 years old, with visible mild or moderate signs of aging, that agreed to participate in the full 6-month study and signed informed consent. Exclusion criteria were also very typical, like pregnancy, breastfeeding, prior treatments with not biodegradable fillers, or treatment with hyaluronic acid-free mold. Also, all inflammatory skin disorder, infections, both viral or bacterial, also non-plastic disorders, systemic uncontrolled disorders, allergy to many products, history of alcohol abuse or permanent use of narcotics, non-steroid anti-inflammatory agents, and so on. And the primary objective of my studies were, first of all, to confirm the efficacy of sunekosperforma injectable treatments on main signs of face skin aging at selected areas in adult women on the basis of subject satisfaction and the novel Aura 3D photos. Also, I wanted to estimate if the efficacy is dose-dependent. That's why I selected those 2 groups. The secondary objectives of my study was to assess the safety of sunekosperforma and also to confirm efficacy by measurements, mostly elastometry and corneometry, and also to check if those measurements will differ between those 2 groups of patients. This is the plan of my study. So as you can see, the treatment was based on 3 procedures 2 weeks apart. And after that, we have follow-up visit with measurements and photos. To remind you, group 1 was injected with 1 ml at the periocular area, 0.5 ml per side. I used the small needle, 32 G4 millimeter long, and the average amount of the product per injection in group 1 was 0.015. In contrast to group 2, when I used double dose and I injected it with total 2 ml of the product. On the leg, the first group was treated with 1.5 ml and the other with 3.5, and forehead, the first treated with 1 ml of the product, while the second was treated with 1.5 ml. What you see here is not allergic reaction, don't worry. Some patients react like this just after injection, but 2 hours later there is no sign, no edema, no redness. And what I also observed after the study, the patient who react like this had a better final outcome considering the wrinkles depth. And I will show you the picture in a little while. Considering results of my study, in both groups the patient had a similar mean age, it was around 45. We measured height, weight, we calculated BMI, we also checked systolic and diastolic blood pressure as well as heart rate. All our patients were really healthy with normal weight in 73% of cases. Some patients were overweight, but it wasn't higher than 26% of the patients. Phototype 2 predominated, but in Poland is normal. We are phototype 1 and 2 mostly, sometimes phototype 3. And when we analyze the results on the forehead, considering skin elasticity, we noticed that in the group who received a higher dose, the results were better. Actually, the results were really good when we used also lower amount of the product, and the difference was statistically significant, but the better results were in the second group. It was even more visible in hydration. The level of hydration was higher in the patients who were treated with a higher dose of the product in the forehead area. And when you look at the picture, you can see really nice results. And I would like to mention that none of the 60 patients I included in the study was treated with botulinum toxin before. They were like native to botulinum toxin to have really real results. And when you look at the skin on the forehead, it's not only the reduction of wrinkles, but also you can see the change of the skin structure. We can see it's more dense, it's lighter, and the color of the skin is much better after the free treatments. This is another older patient with also beautiful results just with free treatments with sunekosperforma. And again, you see much improvement considering the wrinkles depth, but also in skin quality. When we analyze the periocular area, I didn't find a statistically significant difference in elasticity in two groups treated with two different volumes of the product. Probably this is because of the specific skin under the eye. You know that the skin thickness at this area is very, very low, is 0.2 millimeter. So the number of fibroblasts we want to stimulate is very low. So we observed improvement in skin elasticity, but it wasn't dose dependent. In contrast to hydration, here, where I saw a big difference in the group treated with bigger volume of the product. The hydration was much higher, and it was a statistically significant difference. And when you look at the picture, you will see the nice reduction of the wrinkles, but also we observe the reduction of under eye shadows and big improvement on the skin color and the skin quality. Even here, the skin is much lighter, the wrinkles are more superficial, and it was just 3 treatments. This is the youngest patient. She was 23 years old, and she was treated with the smaller volume. She was in the group 1, so she received only 0.5 ml per side, and she was really impressed with the final result because the main problem were shadows under eyes, and after the treatment they disappeared, and the result was really long-lasting. So I think it's a great solution for young patients and very economic one, because we don't need big amount of products for this group of patients. And this is other patient with also very beautiful results considering the skin structure and the wrinkles depth. And actually, this is the best result in other patients considering periocular area with sunekosperforma, and she's not smiling at the first picture. I will show you the full face, but this is the patient who has this big edema I showed you at the beginning of my lecture. She reacted with edema, but it lasted maximum 2 hours, but the final result in the aspect of wrinkle reduction is spectacular. And this is her full face. You see, she's not smiling. So actually, she's number 1 of my patients considering the result in this study. And as you can see, she doesn't have very thick skin, but the response is really incredible. And the last area I treated was the neck. And the neck was definitely dose dependent, considering the improvement in the aspect of elasticity and hydration. And when you look at the pictures, you can observe the very nice reduction of depth of the wrinkles, but also the skin color, the skin texture, the skin density. Here we see very, very nice improvement. It was done with 3D Aura device, and the quality of the pictures I think is very high. I think you appreciate it. And we observed very nice reduction with wrinkles and improvement on skin quality. When we analyze wrinkle assessment scales, considering all those three areas, we observe statistically significant reduction of wrinkles in both groups, but it was better in the second group when we used higher amounts of the product. And considering wrinkles, the best improvement we achieved at periocular area, but you saw it at the picture I presented during this lecture. So, to conclude my study, I would sum up that sunekosperforma is safe and efficient procedure in wrinkles reduction when we use 3 treatments 2 weeks apart protocol. It is also excellent to increase hydration and elasticity of the skin at treated areas like forehead, periocular, and neck. And the obtained results are dose-dependent. The higher amounts of the investigated product gave statistically significant better results. Thank you very much for your attention. If you have any questions, please follow my Instagram and send me information. I will answer with a big pleasure.
That's it. Undershot the what data.
Good morning, everyone. Today, we are going to dive deeper, not just the science, which we usually focus on, but we're going to spend some time now to talk about the anatomy of the skin and how the anatomy correlates to injection techniques that can give you and your doctors better, longer lasting, and safer results.
Yeah.
Ab said something very interesting. He said you can have 2 weights of hyaluronic acid and potentially get a different effect. The same is true for injection techniques. This product works on such a precise molecular level that we're willing to teach you how to advance it further with better results. And it all has to do with Langer lines. Almost 200 years ago, Carl Langer noticed that our skin has directional lines. At that time, we didn't know much about it, but it set forth research and thinking, what do these lines represent? At first, everyone thought they were random, but we know better now. So let's dive from the surface below. What are Langer lines? When you think about collagen fibers, we think of linear patterns. Collagen assembly is not random. Collagen deposition is not random. Under our skin, we have linear directional assembly lines, represented by Langer lines that we see.
That was.
They're usually perpendicular to muscle action, and we know that the Langer lines are not static but dynamic, with movement, and they change over time. What's important to know is that the Langer lines give us an insight of what's happening underneath, what direction the collagen fibers are going, what direction the collagen fibers are aging, and they guide natural tissue response patterns. Let's dive even deeper. So we see them on our surface. We know it's because of directional collagen fiber allocation. But how does it relate to aging? Well, aging is progressive protein loss. Now, if we think about it, if our proteins and collagens are aligned in a specific vector or direction, their loss in that vector direction would be manifested superficially. And it is. We call it wrinkles. Same happens for elastin degradation and ECM. In fact, it's the vector aging that Langer lines represent. And how can we use this to our advantage? Well, By knowing the pattern of degradation, we can assess our patients on a personal level. We know that on the forehead, the Langer lines are generally horizontal. Around the eyes and mouth, because of the orbiculaire structure or as an oculi positioning, they're more oblique. And on the face, oblique to horizontal line. So why does Sunekos work? Why are we seeing such good results? Well, first of all, you have to apply, and we'll see later how, perpendicular to these Langer lines. So if the Langer lines are giving us the direction of protein loss, the direction of extracellular matrix degradation, and the direction of aging, we can use that to our advantage. And we do so by injecting perpendicular to these lines. Why is this important? Well, when you inject perpendicular to these lines, your product distribution is enhanced. It's following the body's natural architecture. Okay? Just remember, Langer lines represent the vector mechanical axis of tension distribution. By applying Sunekos perpendicular to these lines, it's like picturing a fish. A fish is swimming in the ocean and comes across a net. Well, it's much easier to swim along the net than it is to try to go through it. The same is true with Sunekos. When you apply via the body's natural structure, you reduce tissue trauma and inflammation. You're not fighting against the collagen fibers, you're going with them. The material is better integrated into the extracellular matrix. What this means is more fibroblasts are being activated. The product is being more efficient with the same volume. And this is important because we know Sunekos is restoring all of the components of the ECM. Collagen 1, 3, 4, 7, fibronectin, elastin, and as we heard yesterday, 5 and 17. But Langer lines are not only specific to the face. They can be applied for all of Sunekos products across the entire body.
What if we can do to the
So compared to a traditional random approach technique and a vector technique, which we'll show you soon, we've seen, and it's been shown, that there's a 40% improvement in patient satisfaction. But why? Why does it matter? Well, by using the Langer line, you're given an injection method. It's given to you. It's on the surface. Your doctors can use it to decrease inflammation because they decrease the amount of damage done by the needle to collagen fibers by working with it. And when you decrease the damage and the inflammation, you have less vascular injury and less edema. We all know how important this is to the patient and of course to your doctors. This reduces side effects and downtime. So remember, Langer lines give you a map of where to inject. Always consider age-related anatomical changes, such as fat loss, bony atrophy. Assess your patient both without muscle movement and with muscle movement because Langer lines can rotate. And this will give you personal treatment protocols. Okay? And by understanding the Langer line anatomy, we can achieve superior, long-lasting outcomes. Now, we've been told that we're able to have a break now, but because we're running a little late, if If anyone needs refreshments, take some time, go ahead, feel free to do it. I've been asked to continue on to the next lecture. So if anyone needs a bathroom break or a coffee or a drink, feel free to get up and go, but we're gonna continue now into the next section, and I won't take up too much of your time. And it builds on what we just talked about. Vectored protein loss, Langer lines, mapping out, okay, it sounds great, but how do we convey this to our doctors or the doctors in their own? How do I do this? It's not an easy, it's an easy concept, but we have to go through it. So, before we get into sticking the needle into the skin, I'd like to spend a few moments on this slide. You've all seen it. It is the Sunekos facial protocol. You're thinking to yourself, yeah, okay, now what? What are we going to hear with Stu? The importance of Sunekos 1200 in Performa in the first session. Because the first session is different than the second, third, and fourth sessions. The products are highly engineered. We heard from Abs, we heard from Dr. Boca, how specific and how balance is important, how molecular weights are important. And this protocol was designed to be the most efficient possible. And why are we repeating this? We hear of examples all over the world where, especially us plastic surgeons, I'm a plastic surgeon, we think we are the smartest and the best. Like, if you're gonna give us a protocol, we're gonna come up with our own that's gonna be better. But it's not. Professional dietetics has almost 30 years of experience in amino acid and regeneration. This isn't, we didn't sit over an espresso in Milan and go, okay, how many days in between are we gonna do? Or should we do some 1200 here, 1200 here? This is scientifically tailored. And it's the best protocol that you can use. Because the first session is the repair session, the anti-inflammatory session. Without it, and that's because of the high molecular weight hyaluronic acid, and without repairing the under your skin, the extracellular matrix, without decreasing that inflammation, these two sessions will not be as effective. You're not going to get the protein, elastin, fibronectin concentration that you want to achieve, that you should achieve. But then why isn't 1200 in the other sessions if it's so good? Well, because it's a different signal. This is the rebuild session, just with Performa. The same as the Mate. It is engineered to perfection, and there is no need to alter it. We've given it to you on a silver platter. Most of you have seen this slide. If you've noticed, and pay attention more to it now, the Langer lines on the standard face, and how the injection points are perpendicular to it for the reasons we mentioned. But not all faces are the same. This is our model from before. So let's treat her. Session 1, we do 1200. How do we do it? 1200 targets the deep dermis. I like to use a cannula in a fanning technique that's going to cover the entire midface. Of course, avoiding sensitive areas like the eyes and forehead. We keep Sunekos 1200, the high molecular weight, in this region. And after that comes the sunekosperforma. According to her Langer lines, it's a standard protocol. Perpendicular to achieve maximum results, minimize the inflammation and damage caused by the needle, and minimizing side effects such as edema and bruising. But not all of our patients are perfect like this. What about a patient like this? 55-year-old, never had any treatment done, came to me first time, just got divorced, wanted to do something for herself. Right? Beautiful story. Well, we do the Sunekos protocol. 1200 with a nice fanning technique. That doesn't change much. But let's look at her Langer lines. This is her aging pattern. This is how mechanical tension over years has distributed across her skin. And she's giving us the roadmap of how to inject. And then we inject sunekosperforma. I use 32 gauge 4 millimeter needle, angled at 45 degrees to the skin to hit the target layer of the mid-dermis. And why is this our target layer for sunekosperforma? Because this is where the highest concentration of fibroblasts are located. Respecting her Langer lines and a perpendicular approach, this was my injection pattern. I want to reiterate, we are talking about altering injection points based on the individual. I am not changing the number of injection points. I'm not changing the spacing. This isn't a free ticket to put 60, 70 injection points because she has different Langer lines. The base injection protocol is respected with minor alterations for a personal approach. This is her the first time she came. This is her after 3 months. No other treatment. So at least she told me that. She calls me up a year later and goes, okay, you mentioned after a year we're gonna repeat the protocol. I go, wonderful. And this is her results after 1 year before being treated. Okay? What's important to notice here, and why I love this product, is that Sunekos does two things for me and my patients. It calms down the environment, giving you the ability for your body to turn on its regenerative capabilities. Sunekos activates your body. It's not a foreign body response. It's your body regenerating with the help of Sunekos. And the second thing it does is that even after we stop treatments, there's a long-lasting effect. The regeneration cycle continues, and it's continuing long-term. And that's what patients love to see. An immediate result, because we talked about how important this is, and a long-term result. So this is patient number 1. Another patient comes in, completely different from the first. So let's treat her. I mean, we did the normal perpendicular treatments for this patient. Would it work for the other patient? Well, as we see, she has completely different aging patterns. So the aging pattern on the first patient that came in would not necessarily be the most effective. For the second patient, it would work and it'd be great. Well, let's do it even better. So by remapping her Langer lines compared to this patient's Langer lines, I drew the arrows of vector protein loss. And you can see how between patients, the aging pattern is different. What's important is two things. The injection technique is still perpendicular to Langer lines. That's the key. And second of all, the number of points is roughly the same, with slight alteration. Giving us results after 6 months, like this. We have wonderful pictures from around the world. Our colleagues from Japan are seeing amazing results. Thank you for that picture, Dr. Hashimoto. And I want you to remember that there are so many factors related to aging for each and every one of you. Every single person in this space, in this room, is aging in a similar fashion with slight alterations. And when your patient comes in, or your client's patient comes in, a targeted approach with Sunekos, an increase not only the result, but their happiness through decreased complications. And now, let's shift the focus to a very delicate area of our body. An area where many patients come in and say, "Doctor, my eyes, what am I going to do with my eyes?" Because eyes, no pun intended, are some of the first spots of aging that we see. So we're going to go through a little bit of anatomy, why that is, and then we're going to touch on injection techniques, how to increase the efficiency of your results. And secondly, how to avoid complications. Because if there's any point on the face where complications can occur, it's the periocular region. So the skin around the eyes is the thinnest skin in the entire body. Only 0.3 to 0.5 millimeters thick. Behind that skin, we have multiple structures. We have ligaments, we have fat pads, we have veins, we have arteries, we have nerves, we have lymphatic system. So let's touch on the first point of injection technique and what to avoid. 2 centimeters inferior and 2 centimeters laterally from the medial line is the infraorbital foramen. And through the infraorbital foramen, we have the infraorbital nerve, artery, and vein. When injecting Sunekos in this area, especially if the needle or cannula is too deep, you can cause the patient pain. Not just by inserting or touching the nerve, but adding volume or product close to that foramen. What it's going to do is going to compress the nerve, and the patient has discomfort for several days. We know in our practices that pain is one of the biggest deterrents to treatments. If a patient experienced previous pain with a treatment, they seldom come back for the same treatment. The first time a patient comes in, what are they most concerned about? The needle. Does it hurt? And that's why by avoiding this area, you can avoid that complication. Because if a patient experiences pain through your treatment, it's usually not a good sign. Usually we get the messages, we get the phone calls, you have to deal with it, it's a headache. And that patient, unfortunately, is not going to sit at coffee with their friends and say it was a wonderful experience. The second area to avoid is when we start injecting closer to the eyelid. The skin under the eyelid, we mentioned how thin it is and what's behind it. First of all, there's a very thin layer of muscle. And if you inject too deep, the muscle has arteries and veins that can be punctured and cause a hematoma. That, for me, is the second biggest concern. Not because it won't go away, but just like the pain, patient is not satisfied. Especially periocular hematomas that take weeks. And then change that yellow color, and when it changes to yellow, they're calling you going, something's happening, when something's not wrong. We've all seen this before. Behind the muscle, you have 2 important fat pads, soup and the roof, subapicularis oculi and retropicularis oculi fat pads. Those fat pads are responsible for the signs of aging around our eyes, for the tear trough hollowing. When they atrophy or herniate, they change the anatomical structure. When injecting too deep into these fat pads, you can expand them. And when you expand them, you get the puffiness, the long-term puffiness under the eyes. And it's not just injecting into them. Large amounts of volume in this area can create puffiness as well. So you want to be very superficial when injecting to avoid these structures and to avoid complications. Vasculature around the eyelid is highly, highly vascularized, and the vessels are very, very close to where you're injecting. The infraorbital artery anastomoses with the facial artery, and laterally we have the transverse facial artery. I'm not worried about vascular occlusions here. Sunekos is non-cross-linked, you're going to be fine. I'm worried about the hematomas. And of course, lymphatics. Why is he talking about lymphatics? They're not important. Even in med school, you read everything, you got to the lymphatics, you skipped that section because you didn't care about it. No one's going to ask you about lymphatics. Lymphatics, for me, are one of the most important things in this area when injecting. Why? First of all, what are lymphatics? Lymphatic system is your drainage of your entire body, of the extracellular matrix. It's like the piping in your home that takes water and sewage away from it. It's very integral to the extracellular matrix homeostasis. It's like the filter system of that area. We seldom talk about it because we're usually not given enough time. But if we're regenerating the extracellular matrix, if we're regenerating the tissues, the lymphatic system has to be functional. You get the best result. And why is it important in lymphatics? Lymphatics are very tiny. You're not going to puncture a lymphatic. That's not the problem. The problem is because they're so thin and weak that if you place too much product in this area. So first of all, we talked about the needle causing damage. Now we're talking about too much volume causing damage. Because if you overfill this area and use too much volume, what you're going to do, you're going to compress those lymphatic systems. It's like blocking the outflow in your house. So if you have a blocked pipe, what happens? It doesn't go out, it overflows and it stays. And the same thing is happening under your skin. And that is manifested by chronic edema that can last for weeks until this area recovers. And any patient that has had chronic edema for weeks after being treated with the most wonderful thing to regenerate their skin is rarely going to trust you for a second treatment. It's very important to focus and to be aware of this. And the 3 signs of aging for the periocular area, we mentioned the first one, the tear trough, the thinning, that's because of the fat loss. Lymphatic edema, because of lymphatic insufficiency. And the third, the dark circles. Doctor, I have dark circles, what are we gonna do? Well, Sunekos is a wonderful treatment for dark circles. But why do dark circles occur? Most individuals believe it's pigment, and some degree it is, because chronic inflammation causes hyperpigmentation. So in that respect, it could be. But the majority of dark circles aren't pigment. What's happening is because this area is so thin, light is able to pass deeper and deeper, and let's say on the arms or legs or the abdomen. Because of that, it hits the vascular layer, the layer where all the veins are located. And the veins are blue on our body. The reason veins are blue is because they're reflecting blue light. Well, that's what's occurring in this region. Because it's so thin, the light's coming in, bouncing off, reflecting off the veins and the venous plexuses, and it's manifesting as a dark pigmented area. So how can we treat this? All we have to do is increase the distance the light has to travel. How do we do that? We regenerate the extracellular matrix with all of the components, because you need all of the collagen types, you need the fibronectin, and you need the hydration for that effect. And that's why Sunekos is, for me, now it's my opinion, the best treatment for bags or for dark circles around the eyes out of everything. And I've tried everything. And the protocol is simple, because I have patients that come just for that treatment. And significant improvement is usually seen after 2 treatments. Of course, you can do more, but usually 2 is suffice. Where to inject? around the eye, but not medially to the mid-pupillary line. And why is that? For safety. Here you have vascular structures and anastomoses that you want to avoid. It's very, very thin, so keep it safe. But don't worry, by injecting here, because Sunekos is so liquidy or less viscous, it will spread into the area and treat it as well. So anatomical knowledge is so valuable when treating this area. We talked about depth. By most of us use the 4mm needle. So let's look what we can damage with a 4mm needle. Well, we're into the orbital fat pads. If you go too deep, and we're going to get chronic edema. You can injure the arteries, causing hematoma. Orbital septum or the ligaments, also very painful if you inject into them. And remember, your target zone is the mid-dermis, 3 to 4 millimeters, 0.3 to 0.4 millimeters deep. And how big is that? It's about the size of 3 sheets of paper. So look on your desk, 3 papers thick. That's the maximum you should be injecting into. So how do I do it? Well, this is one of my patients I was injecting. So I take my 4mm needle, I lay it perpendicular to the skin, right on the skin, and then I press down just a tad and add a little bolus. No 45 degree in this area, because that would be too deep. Just put the needle tip onto the skin, slight compression down, and low bolus. Remember, there are 2 factors that are important here, depth and volume. We do not want to overfill this area. And these are the results we're seeing. Increasing in firmness and texture, creating the thicker extracellular matrix, which is decreasing the dark circles, and just beautiful skin regeneration. Wonderful pictures from associate partner clinics that we're getting. See, not just my pictures. So we see the decreasing of fine line and wrinkles, increasing pigmentation, and just overall better skin quality. It's regenerating. Another picture from Japan. And remember, nobody wants this result. And these are all the possible complications we can have by injecting too deep or putting too much product. Hematoma, edema, swelling, and the worst, an unhappy patient. Use anatomical landmarks. The Langer lines assist you. Don't inject medial to the mid-pupillary line. Don't inject too high under the orbital rim. So if you take your finger and feel the edge of the bone, 1 millimeter below that is your highest point. And then you're safe. And don't worry, the product will migrate up. You'll cover that area, but in a safe manner. Administer gently and slow disposition. I mean, I'm telling this to myself, plastic surgeons go, I know everything, I'm a surgeon. Slow, take your time to avoid everything that we've mentioned. Up next, we have the pleasure to hear about wonderful information of sunekosperforma and a treatment that is very popular, polynucleotides. I thank you very much for your attention. I apologize for skipping the break, but I think later on when we finish earlier, we'll be all happier about that.